Hi friends, welcome back to my channel Agape Vlogs. I know I've taken a long break and I missed you all. Before starting with the second session of the NMC-CBT mock exams, let me thank the very many new subscribers who have stepped into Agape Vlogs and also the ones who are going to be my subscribers. Thank you all, dear one, and I'm so very happy to know that you guys have viewed the NMC mock test to the full length, and very few of you have also given me the feedback that it was very informative. Thank you for your support once again. And those who haven't watched the mock test part 1, please do refer to it. It will be very useful for you if you are going to take the exams. I have put the link above so that you can watch the 25 questions in that video and the remaining in this one. Well, in this video we are going to start from the 26th question. When will you consider giving out information of the patient to a police officer? Option A, if he has a rank of an inspector. Option B, if safety of the public is at risk. Well, I know that all of you have got the answer right, because anyone can answer it. It's a simple question. In fact, if safety of the public is at risk, option B is the right answer, because all of us know that patient details are very highly confidential and we can't share it unless the safety of the public is at risk. Next, 27th question. Listen to the question very carefully. The question says, when should adult patients in acute hospital settings have observations taken? Option A, when they are admitted or initially assessed. A plan should be clearly documented, which identifies which observations should be taken and how frequently subsequent observations should be done. Option B, when they are admitted and then once daily unless they deteriorate. Option C, as indicated by the doctor. Option D, temperature should be taken daily, respirations at night, pulse and blood pressure 4 hourly. These are the 4 options. Option A is the right answer. How many of you have picked it right? Option A says when they are admitted or initially assessed, a plan should be clearly documented, which identifies which observations should be taken and how frequently subsequent observations should be done. So definitely that's going to be the right answer, and hope all of you have picked it right. Next, 28th question. Why are physiological scoring systems or early warning scoring systems used in clinical practice? Option A, they help the nursing staff to accurately predict patient dependency on a shift-by-shift basis. Option B, the system provides an early accurate predictor of deterioration by identifying physiological criteria that alert the nursing staff to a patient at risk. Option C, these scoring systems are carried out as part of a national audit, so we know how sick patients are in the United Kingdom. Option D, they enable nurses to call for assistance from the outreach team or the doctors via an electronic communication system. Here, option B, that is, the system provides an early accurate predictor of deterioration by identifying physiological criteria that alert the nursing staff to a patient at risk, is the right answer. Option B is the right answer here. Now, the 29th question. Listen to it very carefully. You are caring for a patient who has had a recent head injury, and you have been asked to carry out neurological observations every 15 minutes. You assess and find that his pupils are unequal and one is not reactive to light. You are no longer able to rouse him. What are your actions? Option A, continue with your neurological assessment, calculate your Glasgow Coma Scale, that is a GCS, and document clearly. Option B, this is a medical emergency. Basic airway, breathing and circulation should be attended to urgently and senior help should be sought. Option C, refer to the neurology team. Option D, break down the patient's Glasgow Coma Scale as follows. Best verbal response, V = XX. best motor response M equal XX and eye opening E equal XX. Use this when you hand over. So what is the right answer? Have you picked it right? Option B, this is a medical emergency. Basic airway, breathing and circulation should be attended to urgently and senior help should be sought is the right answer. Because you have to understand that you are attending to a patient with a recent head injury and you have been asked to carry out neurological observations every 15 minutes and you assess and find out that his pupils are unequal and that one is not reacting to light, so you are no longer able to arouse him and your actions is definitely going to be option B. That is, this is a medical emergency. Basic airway, breathing and circulation should be attended to urgently and senior help should be sought is the right answer. Hope you got it into your brain. Moving to the 30th question. What are the professional responsibilities of the qualified nurse in medicine's management? Option A, making sure that the group of patients they are caring for receive their medications on time. If they are not competent to administer intravenous medications, they should ask a competent nursing colleague to do so on their behalf. Option B, the safe handling and administration of all medicines to patients in their care. This includes making sure that patients understand the medicines they are taking, the reason they are taking them, and the likely side effects. Option C, making sure they know the names, actions, doses and side effects of all the medications used in their area of clinical practice. Option D, to liaise closely with pharmacies so that their knowledge is up to date. Here, option B, the safe handling and administration of all medicines to patients in their care. This includes making sure that patients understand the medicines they are taking, the reason they are taking them, and the likely side effects is the right answer. This is a professional responsibility of a qualified nurse in medicine management, mind you. Well, moving to the 31st question. On checking the stock balance in the controlled drug record book as a newly qualified nurse, you and a colleague notice a discrepancy. What would you do? Option A, check the cupboard, record book and order book. If the missing drugs aren't found, contact pharmacy to resolve the issue. You will also complete an incident form. Option B, document the discrepancy on an incident form and contact the senior pharmacist on duty. Option C, check the cupboard, record book and order book. If the missing drugs aren't found, the police need to be informed. Option D, check the cupboard, record book and order book and inform the registered nurse or person in charge of the clinical area. If the missing drugs are not found, then inform the most senior nurse on duty. You will also complete an incident form. So definitely option D is the right answer. You need to check the cupboard, record book and order book and inform the registered nurse or person in charge of the clinical area. If the missing drugs are not found, then inform the most senior nurse on duty. You will also complete an incident form. So that is going to be the right answer. Moving to the 32nd question. It is important that patients are effectively fasted prior to surgery in order to option A, reduce the risk of vomiting. Option B, reduce the risk of reflux and inhalation of gastric contents. Option C, prevent vomiting and chest infections. Option D, prevent the patient gagging. Option B, reduce the risk of reflux and inhalation of gastric contents is the right answer. 33rd question. What are the principles of gaining informed consent prior to a planned surgery? Option A, gaining permission for an imminent procedure by providing information in medical terms, ensuring a patient knows the potential risk and intended benefits. Option B, gaining permission from a patient who is competent to give it, providing information both verbally and with written material relating to the planned procedure for them to read on the day of planned surgery. And option C, gaining permission from a patient who is competent to give it by informing them about the procedure and highlighting risk if the procedure is not carried out. And option D, gaining permission from a patient who is competent to give it by providing information in understandable terms prior to surgery, allowing time for answering questions and inviting voluntary participation. Option D, that is the last one, that is we need the voluntary participation of the patient. We need to gain permission from the patient who is competent to give it by providing information in understandable terms and allowing time to answer questions prior to the surgery is the right answer. Okay. Moving on to the 34th question. Anti-embolic stockings, an effective means of reducing the potential of developing a deep vein thrombosis because option A, they promote arterial blood flow, option B, they promote venous blood flow, option C, they reduce the risk of post-operative swelling, and option D, they promote lymphatic fluid flow and drainage. So here the question is, anti-embolic stockings are an effective means of reducing the potential of developing a deep vein thrombosis. So here it is connected to the vein, and the option B, the second one, that is they promote venous blood flow. So you wear an anti-embolic stockings to prevent the potential of developing DVT. So friends, finally we have reached the last question of this session. Question number 35. What functions should a dressing fulfill for effective wound healing? Option A, high humidity, insulation, gaseous exchange and absorbent. Option B, anaerobic, impermeable, conformable, low humidity. Option C, insulation, low humidity, sterile, high adherence. Option D, absorbent, low adherence, anaerobic, high humidity. Option A, high humidity, insulation, gaseous exchange and absorbent are the functions required in a dressing to fulfill effective wound healing. So friends, that's it. Option A is the right answer. I hope you have picked all the answers right. Now we have completed 35 questions. First 25 in section A of the mock test. We have did another video, so any of you who haven't yet seen that video, learn from it. I certainly wish you all good luck in your forthcoming exams. I promise I'll be putting all the remaining questions possible in the coming videos at the earliest possible available date, and I want all of you to stay tuned for it. Keep learning, study well, share with your friends, give me your valuable feedbacks if possible, and I thank you all once again for the wonderful support you people have been giving me so far. Thank you.